Hi, I'm Dr. Eric Westman for Adapt Your Life, and I'm here with Dr. Lisa Koche, and we're at Adapt Tampa. Thank you for coming out today.
Absolutely, thanks for having me. It's been a great event.
Well, did you see some patients out in the audience?
Absolutely, they've been waiting.
Noticed, so, thanks for coming. It's actually a rare opportunity, isn't it, to speak in public with patients, and I'm used to a more clinical setting, one-on-one. But so tell me about your background a bit, how you got into this, and I hear you have a book that I'm going to read really soon.
Absolutely. So I, from day one, because of my experience at an early age to childhood leukemia, being treated all through high school and college, and then I had heart failure from chemotherapy, I've been really out of the box trying to find the cause of disease instead of just treating the symptoms.
This is before you were in medicine in any way.
Yeah, it helped guide me to medicine to search for the answers.
That was quite a story.
It was quite a story, but I knew, I was very blessed at the beginning knowing that there was some higher purpose. I knew on some deep soul level that I was going to be okay. In college, when it relapsed and I got the heart failure, that was pretty scary, but I was still able to graduate in time, take my MCATs, get into medical school, thought I wanted to be a pediatric oncologist and help treat kids with this issue. And actually the first person that interviewed me for med school said, "You don't want to do that. How are you going to do that?" And I started thinking about it and I said, he's right.
It'd be pretty tough, wouldn't it?
I want to prevent that.
Understand it all too well, right?
Absolutely.
Maybe. Well, then how did you figure out what your calling was?
So from that day, I think forward, it was trying to understand the why. And I went through residency, medical school and residency, and every time we were taught something, or every time I would round on a patient and see a problem that they came in with, I would turn to the professors, my attendings, and say, okay, why did that happen? And why are we doing this way? Like, does anybody understand why this person's sick and this one's not? And blank stares. Nobody knew. This is just how we do it. So for me, that wasn't okay. So I went into my primary care practice, just really dedicated on preventing disease, trying to turn it around. I joined the group of the cardiology practice at the university where I was training and doing my residency. They actually left and went into private practice the same year I finished. So they brought me on as a preventive side to the practice, even though I wasn't technically trained in cardiology. I had done a lot of work and had a lot of interest in obesity and nutrition. So I made my own fellowship, basically. Started out my practice inside of theirs, but started studying vascular medicine and obesity, and I started the gastric bypass program at the teaching hospital there. Okay. So brought in a nutritionist and a psychologist, had kind of that team approach to be supportive to the surgeons. And what's really interesting is that relationship ended about 8 or 9 years later when the surgeon said to me, well, you went off on a tangent studying hormones and like adrenals and thyroid. And I laughed at him and I said, you got these people all messed up. I got to figure this out. So that was kind of another turning point, along with my own health, which took a little bit of a dive after my pregnancies, where I had recurrent heart failure, but then I had autoimmune thyroid and a bunch of other things pop up.
So most doctors don't have that personal experience to guide them, and kudos to you to hang in there. And I hope you're getting the gratification now in your practice. What kind of practice do you have, and how would someone find you?
Absolutely. So my practice has really grown organically based on my need to heal myself. Understanding traditional medicine had phenomenal benefits, but not all the answers. So that's when I branched out into things such as the ketogenic diet, found the benefits of mitochondria to be absolutely unbelievable. I branched into something called muscle testing as a diagnostic tool. So we have a naturopath, a different type of upper cervical chiropractic, and what we're really known for is our collaborative approach to patients. So we work on all aspects of the body. We are at Spectra Wellness Solutions. That's on Facebook, Instagram, and our website, spectrawellnesssolutions.com, or drlisakoche.com, where you can find my new book, Get Lit, simple answers to help you overcome fatigue, exhaustion, stress, and problems with your mental focus. So
fantastic. A lot of the diet teaching that you do is lower in carbohydrates. Absolutely. Not always keto.
Absolutely.
And how do you know for whom what's most appropriate?
So I kind of meet the patient where they are. So, my favorite are the people who are pretty cleaned up and they're ready to go full on keto, and we can really optimize them, take them to a next level in performance, work on their mitochondria. But in reality, you and I see people who come in that have a lot of issues. They're on a lot of medications, they have tried diets and failed. So I will see if I can get them off sugar and gluten to start out with, just to cut their inflammation down if they're too overwhelmed by the stress of really going as far down in the carbs as we want them to. So I'll kind of inch them along, we'll heal their gut, get their focus back, make them feel a little bit better, and then we'll turn it up where we'll try to get their carb levels down low enough to really hit and achieve optimal ketosis.
Great. Now in your book you use a metaphor of dim to lit, like I guess a dimmer switch and lighting. And tell me about the book, how you got into that.
Yeah, absolutely. So I had, there was somebody from one of the nutraceutical companies that we use a lot who came in and he said, when is your book going to come out with all this incredible wealth of knowledge you have? And at that time I had a 2-year-old and 10-year-old and this crazy practice and I wasn't feeling great. And I said, I can't make it to the bathroom, so I'm not quite sure I'm going to write a book. And he said, well, let's go, I'm going to help you. So that was kind of a gift.
Oh, fantastic.
And we went through and he just said, how would you treat an athlete and how would you treat a regular person? And let's just provide these tidbits for people in an easy to read. So it's a very quick 45-minute read. And then it got held up a little bit because I was trying to really finalize the Ignite program, which is it's like a 30-day program that's included in the book. And I had tried so many different things, from very strict macro measurements, 12-week programs in the office, read everything I get my hands on, and I just wanted it to be a little bit more flexible, and there's no recipes in there on purpose. So what I did was basically take one of my favorite restaurants, the concept in town, which is you pick a base, you pick a protein, you pick some vegetables, and you pick a fat. So we made it so there's no recipes, but there's only 4 ways to cook things. So it's for simple, fast answers, people like me who, I need to be able to do it easy, or I'm not going to expect other people to do it easy. And then the most important component, which is the mind piece. So we came up with something called the LIT scale. And people start from dim, and we're trying to help them, like you said, get all the way to lit, which is just feeling empowered and positive and happy, and that version of you that lights up the room.
Well, I really like your approach and you gave a great talk today. I think that's going to help a lot of people.
Absolutely.
And thanks again for coming out to Adapt Tampa.
Thanks for having me.